From WFRV TV Local 5, your local election headquarters, this is Newsmaker Sunday with your host, Tom Zaleski.
Good morning. Welcome to Newsmaker Sunday. I'm Tom Zaleski. This week, we discuss the issue of childcare costs in Wisconsin. According to the Economic Policy Institute, the average cost for infant care in our state is $12,567 a year. That's about $1,047 each and every month. Wisconsin is ranked 20th out of 50 states and the District of Columbia for most expensive infant care. And this cost is for just one child. Couples pay in excess of $22,000 for child care for, say, an infant and a 4-year-old. Well, here to discuss the costs involved is Paula Breese, the Executive Director of Family and Child Care Resources of Northeast Wisconsin. Paula, thanks so much for joining us this morning. As we prepared for the show today, the more and more I read about your organization, the more thankful I was that I don't have young children anymore. This is quite the expense. Parents say they pay more for child care than they sometimes pay for their sons or daughters' college tuition. True?
Yes, very true. In-state college tuition is less than sending your child to child care.
Factors in this. Why is this child care cost rising so much?
Well, again, I mean, I think it's been pretty steady, but we have been inexpensive. We have licensing regulations that require a certain number of children per staff. When you look at higher quality programming costs more dollars.
Now, unfortunately, parents have a choice, and this is a big one. You either pay for this child care to the tune of what we just saw, $22,000, or somebody's got to quit their job and stay home. Are you seeing that in our area?
We do see that some in our area, that parents decide that they should work opposite shifts, or that one parent will stay home, especially when the child is young. But that's not an option for a lot of folks, and so it's really difficult. And we are having a child care crisis in locating child care. We do not have enough child care slots in Brown County for the amount of people that have children that are searching for child care.
Interesting that you say alternating shifts. We used to just think that one parent would simply quit their job, but now they really can't.
Right.
Now they're doing alternating shifts.
Right.
Because as we gave the initial figures, when we said $22,000 for a couple of kids, you'd have to make a fair salary to cover that after taxes, would you not?
You would have to make a good salary. And what's so hard about this is that usually parents who have young children are younger, they're early on in their career, and they're not making as much money as, you know, when they're in their 40s and 50s and they've been in their career for a long time. So parents are just starting out. They have high costs for child care, and they have to pay other basic needs. So yeah, it's difficult for them.
And not to mention, you'd rather be home with the kids.
Right. Most people would rather be home with their children, yes.
Exactly, yeah. So what does your organization do?
So again, we can help parents find childcare. So we have all of the group child care centers and the family child care centers that are regulated in our database. So we can do a customized referral based on what a parent might need according to the ages, the hours that the parents work. You know, what are you looking for in childcare? And we can do a customized referral. We can also refer you to the state subsidy program. So again, there's subsidy for parents who don't make enough money to help offset some of those costs for childcare.
Do you find some people calling you are just overwhelmed?
They are overwhelmed. Again, as a young parent, parenting is a tough job, right? So you're trying to find childcare, you're trying to work, you're trying to, you know, manage, you know, wake up time, bedtime, school times for a lot of your kids. So it is a little bit overwhelming. We hope we can alleviate a little bit of that by having somebody talk to our resource and referral specialists and helping us help them find childcare that really meets their needs.
And I imagine a little panic sets in when they start to hear some of these figures, some of these costs that are involved.
Yes, it is. It's very expensive. So again, we try to help them navigate that system to help get subsidy. And try to find childcare that will meet their needs. Again, there's family childcare, there's group childcare. It really depends on what a parent is looking for. So we give them some other tools to use when they're going to visit programs, questions to ask, things to look for, making sure that, the childcare program is regulated and in compliance.
And is there a difference when city people call you as opposed to rural people?
Well, again, there's lack of childcare. So in Brown County alone, you wouldn't think so, but we have what are called childcare deserts. And so those are where there's really not enough childcare for the amount of people that are working and need to have their children in childcare. So in Brown County, like in downtown Green Bay, where again a lot of people are working, that is a childcare desert, and also southern Brown County, like Wrightstown type area. And so people are really searching and they're really having a tough time.
So, childcare deserts, you wouldn't think of a childcare desert as being in Green Bay, downtown Green Bay.
Yes.
I would think of it perhaps as Denmark, Wrightstown.
Yes, in the more rural communities, that is what we think, but that is not the case. 21% of Brown County zip codes are childcare deserts.
Really?
Yes.
Where is the crisis the worst?
Well, I think it's a combination of the fact that parents have a tough time paying for childcare. Childcare is not funded enough to be able to pay people what we ask based on their education and experience. Mm-hmm. So again, when you're looking at a high quality program, you want somebody that has associate's degree or a bachelor's degree, and the pay doesn't reflect that. So people don't stay in childcare for a real long time.
When people are in need of childcare, are you finding that they are faced with these expenses and then one quits their job, or are people planning ahead?
I think they try to plan ahead.
Yeah.
So I think 3 or 4 years ago, when we were more in a recession, people definitely stayed home and took care of their children. Right. Now there's a lot more people hiring, there's a lot more jobs out there, it's easier to find employment, and so now people are going back to work and they're really trying to find those childcare slots, and there isn't any, especially when you're talking about infant care.
How much stress do you see on these people who are seeking your services?
It's quite a bit of stress. Yeah. So we hope to alleviate a little bit of that, again, by working with them, trying to find a program that meets their needs, referring them to other resources that we know in the community. We also have other resources at our own agency that maybe can help support some of those families.
Mm-hmm. Paula, what changed? What is the difference between now and when you and I were growing up? What did our parents do as opposed to what's going on today?
Well, a lot of parents still put their children in childcare, again, but I think we know more now, so we know that quality childcare costs more money. We expect more out of the childcare programs and out of the teachers and the classrooms that our children are in, and so that costs a lot more money.
All right, we continue with Paula Breese and childcare right after this, so please stay with us.